Assalamualaikum and very good day. I am Norzawati Yoep from Center for Communicable Disease Epidemiology Research in IKU, and today I will share on HIV among men having sex with men in Kuala Lumpur from Integrated Bio-behavioural Survey. Globally, 36.7 million people were living with HIV virus at the end of 2015, and 2.1 million people became newly infected with HIV. And in Malaysia, 108,519 HIV cases were reported in 2015, with 3,330 new HIV infections. Men who have sex with men are 19 times more likely to be living with HIV than the general population. In Kuala Lumpur, number of positive HIV cases are attributable to MSM. In 2015, 66.7% of HIV cases were found among MSM. The study aimed to describe the prevalence of HIV among MSM in Kuala Lumpur and the associated factors. It was a cross-sectional study where 100 men were recruited using the respondent-driven sample technique in Kuala Lumpur. All eligible participants were included based on the inclusion criteria as Malaysian citizen, aged 19 years and above, had history of having anal intercourse with another man at least for the past 3 months, able to give informed consent for the HIV screening, and had a valid coupon to enroll for the study. The study was conducted from January to March 2015. Participants were interviewed face-to-face using a structured survey instruments from WHO Bio-behavioural Survey Guidelines. At the end of the session, the participants who consented were screened with HIV with a rapid test kit. Data were analysed using RDS analysis and SPSS for descriptive and bivariate analysis. For the demographic variables, majority of the respondents were young age, between 20 to 29, Malay, had secondary education, employed and not married. The prevalence of HIV among MSM was 22%. Factors associated for HIV among MSM are education level, HIV stigma, disapprove of lifestyle or behavior, sex partners, use drugs, and ever had sexual transmitted diseases. HIV among MSM are relatively high among young age group, especially those who age 20 to 29 years old, indicate an early onset of exposure. This scenario might due to the ignorance of HIV transmission modes and prevention programs were not sufficient. The facility and access to the internet would give a great impact to watch for homosexual pornography and looking for sexual partners, as the young generations are mostly to surf the internet. Many men who have sex with men will normally have experienced stigma, discrimination, and violence, causing them to hide their identity and their sexual orientation. As a result, they are less likely to access health services, thus keep them away from knowing the HIV status. Looking at the behavioral factor, having multiple sexual partners is more common among this community, and many of them do not use condom regularly. In this study, it shows that having a sexual transmitted infection will increase the risk of getting HIV infection. Men having sex with men have higher chances of getting HIV compared to other populations. From this study, all these findings focus on young age men who have sex with men, especially in Kuala Lumpur. However, the sample size is not sufficient to infer the results to the population. Nonetheless, a continuous education and promotion on safer sex, testing for HIV, and other promotions should be enhanced. Thank you for your interest. And this paper was published in Journal for Health Management in 2019, and you can get a copy of it from the NIH website. Thank you.